Hi, do you know that the nitroxide or funny gas now the second most commonly used drug amongst young people in UK? Do you hear about nitroxide induced subacute combined degeneration of the cord? So do you know how to manage that in emergency setting? First of all, I'm Dr. Mohanad Abdul Majid and I'm one of the FRCM Academy course instructor, and today I will highlight on the nitroxide poisoning management in ED setting. Before we start, to be honest, I have chosen this topic because I believe it's a common area of questions in FRChem and MRChem exams. So if you are preparing yourself for the next exam, please consider this topic. Let's start with definitions. The nitroxide-induced subacute combined degeneration of the cord is a pattern of myeloneuropathy which is usually associated with a severe B12 deficiency. So, what are the symptoms and the signs? Usually these patients, they are presenting with gait disturbance, paresthesia, weakness, numbness, or ataxia, and history of nitroxide use. Those patients either use large amounts of nitroxide regularly for weeks to months, or even after single use if they got background of B12 deficiency. Please don't forget the diagnosis of nitroxide subacute combined degeneration of the cord. It's based on the clinical judgment. So don't delay the treatment while you're waiting for the investigation's result. Okay, so briefly, what is the management? So you are working the ED and the next patient. This is the common scenario either in the exam or even during your practice in UK. So your next patient is the male, 23 to 27 years old, came with ataxia, paresthesia, weakness, all of them or one of them. What and he mentioned that or she mentioned that I have used nitroxide in the past or recently. And don't forget, if they didn't tell if they will not tell you if you didn't ask. So please ask this question directly. Did you use funny gas in the past, or are you using funny gas nowadays? So what you will do, please do full neurological examinations and do the following investigations, which is full blood count, UNEs, liver function test, thyroid function test, B12, and folate. And as I mentioned before, initiate the treatment in ED. The treatment will be stat dose of hydroxycobalamin. Stat dose of hydroxycobalamin, 1 milligram intramuscular. Don't forget to discuss with neurology if concerning differentials. When we are concerning differential, if we found some visual change, or there was a history of recent infective illness, or there was a symptom of or there was a ascending symptoms, or you found the blood pressure is fluctuating, or there was a tachycardia or arrhythmia. So you have to discuss with neurology on call. Also, I will discuss with neurology on call if the patient, if immunosuppressive, if there was a history of cancer, if there was a back pain or fever. Okay, well done. You initiate the treatment, you requested the blood, and You consider the red flags and the concerning histories. Now, what to do? Shall I keep the patient or discharge? So please admit any patients who got new inability to self care. If the patient unable to do his self care, that meaning he need admissions. What we call it in UK social admissions. If there is no concern about that, you will discharge the patients with urgent referral within 1 to 2 days to ambulatory care or neurology day unit. And don't forget the patient educations. And patient educations always the common questions in OSCE stations. What you have to tell the patients? You have to tell the patient you must stop using the nitrous oxide immediately to give a chance for B12 injections to work. And you have also to tell the patients, please make sure you are attending your outpatients appointment and take the treatment as outpatients, because normally the treatments outpatients will be regular B12 injections. And also ask your patients that she or he should engage with a local drug and low alcohol service. Thank you so much. That was my talk for today, and good luck for everyone.